Thank you.
So, just briefly, what we're looking at is in this particular unit, these 4 or 5 major contexts that you're looking at, and some of these then have to be dealt within the specific remit of the health and social care, what do you call, context. So let's look at the learning outcome 4 in particular. And here we are understanding what is oral communication, and what are the tools and techniques that you use to deliver oral communication. And as you can see from the indicative content here, it talks about oral presentation. Also in the slide, basically it makes use of a form of presentation which we are doing as of now, in terms of I'm showing you a PowerPoint presentation slide, and I'm using that presentation software to be able to share details of the the course and the content with you. And this is being done with certain techniques involved in the delivery, which would be meaning the Microsoft software, which is PowerPoint. In some cases, when you're in a classroom setting, you'll be looking at things like handouts to give out. Could look at if you're delivering a training that would be used, and obviously the question answer session or queries that the other participants are able to raise when that discussion is happening. With regards to, let's look at the content now. I'm going to go on to the slides just to sort this out. So going into something which is oral communication in particular. Okay. Just give me 1 second. This is something that I'm going to send, obviously email it to you after the session, but just going through some of the slides rather than go through all the slides here.
Okay.
Right. So I'll try and go through some of the slides with that. What I'm going to do is some are self-explanatory. Would kind of skip those, and you can go through them when I send them to you on the email and upload it on the Learner Manager. So here, what we're looking at essentially, when we look at learning outcome 4, the idea is understanding of oral communication and what are the various types of oral communications that you can do. When do you use this? And what are the advantages and disadvantages of doing oral communication. So basic, just to kind of, this is a word that repetitively throughout this unit, which is the word communication. And it is the definition of this word is that it is, in a broad sense, it is defined as, the procedures or, the art of, various things that we have looked at in the communication process, which is the sender, receiver, the message, the feedback. Here, we basically use that process to be able to communicate with, people, peers, staff. And in that, we make use of, either written, oral, pictures. And, what we do is we basically communicate even emotions and things like that using the word conversation. And that is essentially nothing but it encompasses what is called communication. So it kind of summarizes this as a definition in terms of what we look at. And activity. I think you are well aware that, when you look at the communication theories that we've discussed earlier, it is in the best interest of the organization when you study is that if you do not send out messages, if you do not send out communication in terms of verbal, oral, you do not communicate, then there is very little which you can receive back from customers or, feedback in terms of, response or feedback which you can receive from, customers or consumers in a business context. But when you look at, the flow and how it happens is, in our case, if we are discussing at this moment, I kind of constitute something called the sender. You on the other side is the receiver. In between, the processing which is happening because of the use of technology is nothing but, the message which is being translated and, transported or communicated through the medium of technology to you. And when you ask me questions or when you ask me, queries, this kind of constitutes something which is called the feedback. Now, we have discussed formal and informal, types of communication. When you see communication is, when you look at oral communication, when you look at written communication, communication can be directional as well. And that means directional would mean that if the communication is coming from the top, that means board of directors, that would then be seen that it is going to the managers and managers would pass it on to the employees. That would be seen a downward, trend in, or what you call it, the downward form of communication. Sometimes you receive feedback from the customers. Customers' feedback is gathered by the employees. Employees then summarize it and then pass it on to the manager. And that form of communication, as you can see, moves from, up, it moves upwards. That means it's coming from the first line of contact or the customer agent, service agent, and it is going up to the top management because it is something important. And sometimes you will feel that the communication is horizontal. That means the example here would be that if you work within an office or work within a setting wherein you have colleagues and you have peers, and sometimes the communication that you have with equal or, your peers in the organization, is traveling at a horizontal level. That means you and somebody else who's having a chat or a conversation is at the same level and you discuss things, and that becomes, the level of that communication is primarily horizontal. There is these basics, the basics of the sender, the communication process, the receiver, the media chat. This is something which is going to be important for learning outcome 5. When you look at written form of communication in particular, these are all medias or technology which are used to look at communicating verbally. So telephone, for example, uses what type of communication? Verbal. When you look at email, it is classified as a written form of communication. Letters are also written. When we have video conferencing, so for example, as of now, we are having a voice chat, but at some stage, if we switch on the camera and we see each other as well, that would become interactive medium, and that would be considered as something called video conference. Face-to-face meetings can happen online using something like this when it's a platform, or the face-to-face meetings can happen within the office, outside, in a cafe, or in a hotel, whatever. And then sometimes you use chat rooms. That means on an online platform, you are wanting to have discussions with a particular person, and sometimes what you do is you kind of go into meeting rooms. If you understand a situation wherein if it's a brick and mortar model, that means you are within an office and you want to discuss something private or have a one-on-one discussion, you normally go to a meeting room. So similarly, internet chat rooms are, virtual rooms which you can discuss, one-on-one in terms of communication with that person, and you can invite them to join a particular chat room. So this will again constitute something verbal form of communication. Now, when you look at the process in particular, it is very important sometimes when you look at situations is that you have to choose an appropriate medium for you to communicate to your audience. And that appropriate medium in some cases dictates the type of communication method that you will use. So this is important. Sometimes when you communicate, you have to choose the appropriate medium, and that medium then dictates what type of method of communication you will use. So say, for example, you're going to invite a number of your friends to come and attend your birthday party. So you could choose to do and send an invite and call them up on the phone personally. The other way would be you would probably send across, a written form of communication, a letter or a card, which will say that so-and-so day, with so-and-so arrangement, please kindly attend. And that, in that case, would dictate the kind of medium that you choose or the method that you choose to do that communication, because it is relevant as far as the event is concerned. So sometimes when you look at written media, in terms of written form of communication becomes a formality. That means you would like to formalize that arrangement, and in order for the message to be communicated clearly with all the desired variables, things like the time on which you're celebrating your birthday, the place where it will be celebrated, and the dress code and things like that, then in that case you would choose something which is a written media or a written form of communication. You look at these settings wherein an example wherein you choose face-to-face meetings is they are normally done when you are working within teams. It could be done when you are wanting to communicate specifically a message to a particular user, and this then can be complemented by sending minutes of the meeting or summary of the minutes of the meeting via email, and then it's a combination of doing oral communication, and then which is supplemented by something sent across on the minutes of the meeting as via email. So email in general has become one of the most important mediums of written communication today in modern life, because one, email is free. It is quite efficient in terms of it is delivered promptly, you get instant response, and sometimes you'd send an email because you're trying to avoid speaking to the other person, and you would want to create a written form of record, which then is created when you send an email. Now, feedback we've discussed. Sometimes you get the response or feedback from the user, and that is to clarify a message or maybe add or to a query that or raise a question, and that completes the process of communication. So here the idea is to go through some of these slides to recap the basics of noise, things like errors, distortions. So for example, sometimes when I'm or there's an echo on the voice or things like that, that constitutes nothing but distortions or noise in the communication. We've done. I'll go forward. Going global, we've covered these oral. So the bit here, which is learning outcome 4, so all forms of speech between a which are done orally. That means your speaking is nothing but under verbal. That is called oral communication. Now, oral communication leaves no permanent retrievable record of the message and response unless recorded. Is that something which is very clear? Because you requested that can I record this conference, record this particular session. So if I had not recorded, then the oral communication leaves no permanent record. But because it's now being recorded, it leaves a permanent record as well, which can be viewed later by students at a later point in time.
Yeah.
It can also make the session more effective sometimes, because the full attention of the speaker or the sender is primarily on the receiver, and he or she does not have many distractions when doing oral communication. The other advantage would be that sometimes when you look at the disadvantage here would be sometimes when you look at, if I say something and you interpret that slightly differently, that can lead to a bit of, discontent, or the communication being, interpreted in a different manner. And that is where what you normally tend to do is, when you call up a lot of call centers or, customer services departments, they always end up saying that this call is being recorded for quality and monitoring purposes. The reason why they do that is sometimes the managers actually listening to some of these calls in order for them to pick out the best practices, or areas which need further improvement, and that's how those areas are then picked up and put into training and development, in tandem with the HR department, or the training manager. One of the forms of verbal communication could be the sign language, which is British Sign Language, American Sign Language, in terms of somebody having disability. And that is where you use the use of facial expressions and body movements, to be able to communicate. Written form of communication, I'm going to skip this. Okay, now coming here, which is verbal again. So verbal, within verbal, and then within oral communication, we can also use technology, which is electronics or video communication to deliver a message. And this then can be done through the use of technology, and the various forms of aid or implements that we use to bring technology to communication is, things like video conferencing, things like voice chat. And when you look at the written side of things, then in that case it becomes the email, the faxes that we send across, the video conferencing that you do, provided it is recorded, and you're able to see a screen. So in our case, when we are doing this conversation, it's not entirely verbal, because you see something on the screen, which is, like a whiteboard or a blackboard. And this whiteboard, which you get to see, you're actually seeing the PowerPoint presentation, and that has a bit of narration from the tutor to be able to explain the slides. So this essentially constitutes, I would say, a written and a verbal form of communication. Do you agree with me on that?
Yes.
Okay. Now, I think the clear advantages. Sorry, go ahead.
No, it's fine, don't worry.
Okay. I think there are one of the tasks of the assignment. You'll have to look at what are the advantages and disadvantages of a type of communication. And when you look at these slides, they will give you some idea in terms of how to pick them up from here, and obviously put them in a tabular form. The use of IT essentially speeds up the translation of communication. That means, one, it makes it more prompt. The communication is almost instant, and at some stage, if it is being done using the technology and it is oral, you get prompt and quick feedback. So, for example, I asked you, you want to ask anything? You said no. So you got a prompt response from the receiver. No, it's absolutely fine. Continue. So oral and verbal communication with the use of technology becomes, a medium wherein you're able to get a response or elicit a response pretty quickly, and it is in some cases very instant. Now, in other forms that we look at, we will discuss primarily just the oral ones here. Now, very briefly, just going through one or two slides. Now, why do you think communication plays a very important role within a business or within an organization in the health and social care context? Can you think of a few reasons why, formal form of communication is very important within the organizational? It could be a care home, it could be a hospital, a college, or an office. Why is it important?
So other workers know what to follow, what's gone on, so they can take off from there, for legal reasons as well, and just to create a paper trail so that you know what's happening.
Yeah, absolutely right. I think there are. So why is verbal communication important within an organizational, or say, let's look at communication. Why is it important? You rightly pointed out that there are certain processes, procedures, or basics in terms of standard, as we call it, the SOPs, the standards of operation, which every employee and staff needs to know, and they can only be communicated to the staff if they have been taken through either these procedures or these processes during an induction verbally, during a training session verbally, or they have been handed over some basic reading material to go through along with the contracts when they sign. And it becomes important because they need to be able to understand why and how some of these things are going to be done within the organizational context. The other thing that you look at why communication also becomes important is that sometimes the only way organizations are able to send out messages to people or send out messages to a target audience is using the medium of communication and and then they choose a particular medium or an appropriate medium to communicate that to their target audience. So look at an example of, say, a pharmacy that is within the area that you live. Now, that pharmacy from time to time will hold a few sessions across the year, like an open surgery or, for example, collection of waste in terms of medicines which have gotten past the expiry date. So what they do is they do awareness weeks and things like that. And the idea is that the surgery, or sorry, in this case, the pharmacy wants to be sending out a message that, hey, we are present here in this particular area and we do this particular function. And what they do is, in order to reach out to their target audience, is they choose an appropriate medium to communicate either verbally or in the written form, so that it's kind of helps them solicit business in the future, but also help generate, a bit of demand in terms of, the sales and the operations of that pharmacy. And a similar context you can look at in the context of, a surgery. So sometimes when you get to see, surgeries do not accept patients, but there comes a time in 1 or 2 years, when they do see a lot of patients have actually transferred over, people have moved houses, then the surgery is able to take on more patients. So what they do is they put up a banner outside saying that we are accepting patients or we are accepting registrations. And this can only happen, or they can only get registrations or new customers coming in to register with a surgery, is if they put out something which is called a message, or a message in the form of communication saying that we are open to accepting new patients and new customers who are in this particular postcode or in this area. So I think there is no organization which can function without the aspect of having this particular element of communication. And in some communication is done to educate people, it is done to solicit business, it could be done in the context of just putting out a journal message for for the public. And in some cases communication is desired to be done in other forms like written written, sometimes verbal, supplemented by written, because they want the message to go across quite clearly. So an example here would be of what I've just said is that with the onset of winters, you normally get to see that your local surgery would actually send out some flyers or leaflets, or they would send out emails to their registered patients saying that the flu jab is now available for people over the age of 70 or children under the age of 7. Have you seen that? Or have you come across that?
That type of information, yes.
Yeah.
So not
and I think
I've seen it on the TV screen when you go and you're waiting for your appointment at the doctor's surgery.
yeah.
I've seen it there on posters.
Yes, that's correct.
That's it.
Yeah. So I think it depends. I've seen that the surgery actually puts out this information in the form of, as you rightly said, maybe a poster or, some sort of a flyer which they put across on the notice board within the surgery, just outside the surgery. But I think for patients which are over 70 and younger children, what they do is they send out, if they're registered and if the surgery has automatic, the appointment system, they normally end up sending in messages, text messages, to the registered numbers to be able to come in and have your jab, isn't it?
Yeah, they send me text messages on.
Yeah. So these are all effective forms of, oral verbal communication, but they are kind of supplemented by, written means, because what tends to happen is you miss out some of these things sometimes and what tends to happen is they kind of send you reminders using technology. So text messaging, message coming across to you as a text saying that you've not taken an appointment, or your son hasn't taken an appointment, for the flu jab, is basically reinforcing the same message that they've sent out, but using technology. What they're doing is they're sending you a gentle reminder via the route of a text message. So, technology has become integrated, and I kind of put it this way, that personally I would put it this way, that, it has become very difficult now to separate the mode or the method of communication from technology, because we end up using it on a daily basis, almost at every given point in time, whether you're on the phone, you're watching TV, or you're sending an email, you're getting something dropped through the post, which comes to your house. They are all different forms of communication, but they are enabled through technology at some stage or the other. So, for example, you get an insurance policy coming through the post, right? At some stage, if you roll back the process, what you would have seen is you would have had a conversation with maybe, say, your insurance broker on the phone, saying that, I want to take out a car insurance or health insurance and things like that. And health insurance policy, you're actually speaking orally or verbally with, a company on the phone. Once everything is finalized, what they do is they send you the policy across in the post and on the email. So an electronic copy, and the person would normally end up asking you, would you prefer it sent through the post? Isn't it?
Yeah.
And if you see that health insurance policy coming in the email, it normally comes through again with the use of technology. But if you say that I want it through post, that again comes to you in the written form, in some written form, which is on printed paper. But if you trace it back again, it's at some point in time, you print it onto the paper using a printer, which is again a form of IT, being used within the process of, communication. Now, looking at some of the, I'm skipping some of the slides because I think the effectiveness of communication, the 7 C's that we discussed in the session. Yes. So I've skipped through that, and I think you can refresh when you go through this presentation. When I email it to you, you can probably refresh some of that material, just to look at that concept of the effectiveness and the use of 7 C's in the communication. Which I'm coming to now is basically the learning outcome 5, which is the use of technology. And here I'm going to again go through some of the slides, but skip some of them, is because I think in learning outcome 5 the onus is primarily looking at the written form of communication and the use of that written form communication. So when we look at things like for example, when you present make a presentation, but in that presentation you're actually presenting data or information using bar charts or graphs, or you're basically looking at presenting the info tables or charts. That then becomes the use of technology again within the context of transmitting a message or communication. So technology and communication, as I was mentioning, is they become quite intertwined, and they are kind of inseparable right now, because the way it is going, we end up using technology in order to communicate our messages. So let's look at, for example, Twitter, right? What is Twitter? How do you define Twitter? Why do you use Twitter? Can you think of a few basic reasons of why you use Twitter?
You can hashtag, and I don't really use Twitter. I've never used Twitter, but I think you can hashtag and your things can trend. Words, and then it goes out to a larger amount of audience. I don't know. I think
that's correct. So when you look at some of the electronic mediums like Instagram, when you look at Pinterest, when you look at Twitter, I think, and when you look at Facebook, for example, these are mediums. Sorry.
Facebook is slightly different, because you have to add like pages, and then you can't really reach out to a lot of people. But with Twitter and Instagram, because you can hashtag, it usually does go out to other people that even have got you as a friend or even liked your page. So
that is absolutely correct. I think when you look at Facebook in particular, if you have a Facebook page, or a business page, and until you've added a user to it, you are only putting out information to a limited circle. But
Yeah.
yes, in the case of Twitter, Pinterest, Instagram, some of the other mediums, it is the circle, and the circle of your friends and the circle of their friends can also end up receiving the communication. So in general, you are using these as platforms. When I put it literally, personally, when I put it literally, is you're actually using these mediums to put out what you feel, or what you want to convey, or what you want to share, with a group of friends or like-minded individuals. So again, here, I think what we are trying to do is, you're using something which is small text messaging. Twitter probably is about also the equivalent of a text messaging that we use on the phone, say 140 characters or so, and you use that to be able to send messages out, which then are broadcasted using that platform to a number of similar users in the group and things like that. So yes, in a nutshell, I think when we look at technology and the use of technology specifically for oral communication, we look at telephones in particular. We also look at things like so the applications like WhatsApp now, which support video calling, FaceTime and things like that. So these are all forms of communication which use both facial, face-to-face, verbal, as well as written form of communication. So when I'm using WhatsApp, for example, and I'm kind of sending you a message, but I'm also talking to you, then it constitutes both written as well as verbal communication, because you're able to see me, I'm talking to you, but I'm also sending you or texting you a message. So technology enables the use of various, basically makes use of methods of communication easier. And I think in some cases it has made it very simple, so that more and more users are able to use it, keeping in mind that some of these things are quite user friendly, and they do not require any complex training, or let's put it this way, you getting used to before using the technology. Now, the use of technology, I think what we will look at is the use of technology in particular would be to look at, when you make, when you want to go across to a large number of audience, you sometimes use technology, wherein you are able to have a group chat, when you are able to, we use a platform called join.me, and that platform enables up to, 2,000 users to join a particular session at any given point in time, and that is only enabled because that is only made possible through the use of technology. Now, imagine this particular line. Why is digital technology very important? Now, when you look at an example of what I said before, like WhatsApp now or FaceTime. Now, here, what we are looking at doing is we're slightly differentiating between technology, and we are calling it digital technology, is because it then integrates different forms of communication in one medium, and that is, you're able to see the person, you're able to hear the person, and at the same point in time, the person is able to text you or message you, or share a picture or a graph or whatever it is. Have you seen that?
Yeah.
Have you come across that? So sometimes when you're you're also talking to your friend or maybe family, and you have the headphones on. So your phone call is on, but the network in the background is also capable of allowing you to text on the phone, or maybe send pictures, or multimedia messaging, MMS messages to your friends and family. And that is nothing but differentiation between technology and digital technology. That means digital technology enables the use of various forms of messaging, which is including text, images, audio and video, even numbers to a certain extent, and all that being used simultaneously when you are talking to somebody on the phone. So there's a slight bit of differentiation here, which, yes, technology makes communication easier, but if I have to ask you a difference between technology and digital technology, I think what you'll have to say is technology enables you to send something across using, say, a facsimile machine or a fax machine. So you can send a fax across. But when you're sending a fax, you can't do anything else. You can't pick up the phone and also call somebody, can you?
No.
No, if there are ways, obviously, but I'm looking at it literally that you have one
Yeah.
phone line, you're sending a fax, you can't pick up the phone and talk until the fax gone through. But when you
Yeah.
look at digital technology, you're talking to somebody on the phone, and that differentiation is that the phone network then allows, because of 3G or 4G, actually allows you to talk to one person, but you're also texting to somebody, you're also uploading an image or a text message, to a number of audience or a group, and that all happens simultaneously.
Yeah.
Now, all this is becoming possible because of the speeds of internet, things like satellite, fiber optics, the use of personal computers as the computing power increases, and also as we, as the world expands and it gets connected, more and more people are able to get connected because of the use or the use of modern technology in terms of digital, nature of technology. So this. And here, I think in particular, the most thing that we're going to be looking at is, I think I'm going to skip through, which is the written form to come to, which is important. That is what we are looking at. All I can come to in a second. Okay, not in this. So this is something which I'll send over to you, which is communication, which will primarily correspond to your learning outcome 4. Okay.
Okay.
Okay, so that presentation will cover that. Now, just briefly going to the types of written communication. I'm going to try and pull out assignment just to show you, and that would simplify that, I think, in terms of communication. Yeah, communication. Yeah, that's the bit I want to show you. Just a bit of activity to look at. So here, what I'm going to look at in particular is written form of communication. Sorry. Right. So this task here, we'll cover this, but just to this because it kind of clearly, highlights the things that we need to cover. Now, imagine I've invited a couple of, candidates down for an interview, right? And I'm interviewing for a position of, say, an administrator / receptionist at the office. Now, what would happen in the interview process? Can you visualize an interview process?
After, on the interview day or before the interview day?
No, before. Just let's look at you finish your course. You're looking for a job now. You have your CV and you're starting from there. So how do you visualize the whole process? Let's look at recapping some of the major milestones that you cover in that process.
You have your CV electronically. A lot of it's a lot of the jobs are advertised online, so you use you're one of those platforms where you apply for jobs.
Yes. Yeah, I can hear you. Yeah, I've just taken the screen offline for a second, but yeah, go ahead.
You submit your CV and then it gets sent through to the organisation. They review it.
Yeah.
And then if they're interested, they give you a call.
Yes.
No. You submit your CV. After you submit your CV, you'll probably get a confirmation email from the website that you applied on. And then if you're rejected, you probably won't hear back from them. Sometimes you will get an email saying if you are unsuccessful. Or then if they're interested in you, they'll call you, or they'll call you. If you don't pick up, they'll probably email you or text you or leave a
Yes.
voicemail message.
Yeah.
Then you'll call them back. After that, you'd arrange an appointment, a date for an interview. They'll
Yes.
probably tell you everything that you have to bring in, and what type of interview it is. They'll probably send you
Yes.
a confirmation email after that to say, to just reiterate what they've said on the phone.
Yes.
And then you'll reply back to that, saying that, if you're confirming your attendance, or absence.
Yes.
Then after that, going on the interview day, go into the interview, and if you're late or anything, then calling in and or then if you don't have the contact number, before you go to the interview, putting together like some details by using the internet to research, like the place's contact details. You can get that from the email that they sent. Or then if you don't have that on the day, you can actually research, find the number, call them to tell them you're going to be late. Once you get there, the organisation might have your CV pulled up on the computer, or would have used the computer to print out your CV.
Correct. So you're absolutely right. So if I just kind of add a few things here. So if I look at it from a macro point of view, what you're looking at is you have some basic things that you have to complete before you even start to make an application. This way, something which is maybe you've prepared something which is like an application pack. That means you have your CV, you have your basic details or your documentations, things like your certificates and other things. After that, what you do is you go on to a forum or you register with a few agencies to be able to make job applications. And then the third bit is when the job applications kind of hit and they become successful, they start looking at the process of shortlisting. They go through the process of phone. You make a phone call. If they're not able to reach you first, obviously they look at things like leaving a voicemail, as you mentioned, and then at some stage you come to a third stage wherein you essentially will land an appointment. And when you land an appointment, you'll be called for an interview. When you go in for an interview, what tends to happen is you will be asked to do, say, because there are lots of candidates which have come in. So what tends to happen is that you'll be asked to, sit in the interview, but what they will do is they will do a bit of shopping. They did not maybe expect that much of a response, of the job advert. So 200 which have applied. So what will happen at that stage is that the agency or the organization will then do a few written tasks. Correct?
Yeah.
Sometimes when you for an interview, what they do is they look at your CV and they have a chat with you, but they also give you a few things to complete, in the interview process. You might end up filling a form. They might ask you to write, maybe if it's your first job, they might ask you to write maybe say, a pager or 200 words on a particular topic. And those are things which they are trying to, pick out using those tools or the techniques. They're trying to actually pick out a few skills which you say you have on the CV, but they want to see it in practice, and that's why they ask you to do something in writing. Are you with me on that?
Yeah.
Yeah. So in terms of the process, 3 or 4 stages, the way you've described, absolutely fine. And those are the exact things that you go through when you apply for a job. But at some stage, assuming you had a good amount of respondents coming back to you, candidates coming in, then the organization might end up doing some sort of a written test or a written, interview, which will kind of further help them in doing a bit of shortlisting. So the bit which is important, which relates to the learning outcome 5 that I'm trying to get to, is that as all the interview job applicants, when they land up at the office or at the organization, they are then asked to do some written tasks to be able to present information completed prior to the interview, right?
Yeah.
So what the organization is then asking you to do is they are asking you to do a bit of tasks which will test your written communication skills, right?
Yeah.
And here, when you look at the written methods of communication, what are the written methods of communication you can bring across into the interview or for an interview? So you have something which is a CV, which is a written form of communication, right? You also sometimes write a covering letter or an opening letter for the interview, isn't it?
Yeah.
So the covering letter, basically, you kind of summarize why you're suited for this vacancy and, why do you think you're the right candidate for this role. You kind of do that in that, opening letter or the covering letter.
Yeah.
And in some cases, what tends to happen is when you look at the written form of communication, if they are very interested and they want to find out a bit more about the candidate before they want them to, come to the interview, they exchange a few emails with you to clarify or maybe seek further information.
Yeah.
Isn't it? Yeah?
Yeah.
And then in some cases, what they say is they send you some sort of an interview pack or a pack, which gives you some information about the organization. And in that pack, what they ask you to do is, okay, here is the job description, right? Here is the application form. And here is the link to our website from where you are expected to study a few things about the organization and related to your role. Have you seen that? Have you kind of, gone through that process?
Yeah, I have.
So in short, what I'm trying to come across to is that the organization or the business, in this case, which is doing the interview, because they want to be very sure that what you say or present in the CV is actually true, sometimes the organization end up testing you on the spot or on the interview through the medium of written communication.
Yeah.
And this is what is desired to be covered, is what we need to cover in the Learning Outcome 5, which basically talks about how do you communicate formally in writing and within the health and social context. Some of the methods that we will use or we can use to do written communication would be things like you have a formal letter or a report that you write, right?
Yeah.
You've seen a number of patients, you're a nurse, for example, or you're a care worker, and you've seen a number of patients throughout the day to day, and your manager expects you to write a brief report before, kind of finish work on that day. Or maybe a report that is required that you write before you finish the week, in terms of how many patients you've seen, what you've discussed, and there comes a summary. So one of the key important types of written communication becomes a letter or a formal report. You also use emails, which become a written form of communication. You sometimes produce or what you call memos or notices, which are put across on the notice board within care homes, surgeries, and things like that. Is because you want that information to be produced, and it is something which is referred to again and again. And that is why what you want to be able to do is produce a poster or write a memo, and that information is then stuck across to a notice board, because it is going to be asked or used time and again. And what you do is you decide to create that in the written form so that it avoids and leads to leads to less time spent orally communicating that to different people time and again. Correct?
Yeah.
So an example of that, what I've just mentioned, would be, to cut the long story short, the short version of that would be, if you go to the surgery and you want to take an appointment, or say, for example, repeat prescription, in particular, repeat prescription. So what you do is you go to the reception, and what they've normally put up a notice saying that you don't need to wait or queue up. All you need to do is, if you want a repeat prescription, just put this in the box and leave.
Yeah.
Isn't it? Yeah. So the reason why this is done and why they've created a template, for repeat prescription, fill up the form and drop it in the box, is because this is something which they expect, and they see that this is something which is going to be used time and again, and there is no point in having this, having the patient queue up and have this verbal communication. It's best that they fill up a form through the written means and drop it in, and somebody at the end of the day picks it up and then takes it to the GP, depending on which GP they are seeing. They look at it, and a nurse can then start writing these repeat prescriptions.
Yeah.
So it is time saving. It also creates a written record in some cases, and in some cases it documents, in serious cases, for example, if a patient has illness and the drug has been prescribed, by the doctor, then in those cases it can only be prescribed by a doctor, not by a nurse. So in those cases, it creates a document and a document trail, as you rightly mentioned earlier in our conversation, that why organizations use written form of communication is they want to create a trail of documentation so that it can be referred to by the employees at any given point in time. So the importance of
They do
formal...
that with important things like with medicines, like in the pharmacy, like when you receive, let's say for a care home, you receive medicines from a pharmacy has to sign the medicines out when it's gone, and then once it's taken to the care home, they must the medicine can't be on the premises without it being signed for. So even if there's a meeting going on in a room, you have to go into the meeting, go into that particular room, get the logbook and log it in, so that they know that it's been handed over, so they know where the medicine is and what it is.
Absolutely correct. Absolutely correct. So in those cases, when you look at, because in this particular sector of health and social care, you're dealing with patients and you're dealing with people which are vulnerable, the written form of communication takes a very, it becomes very important. This has to be structured in a particular way, as you rightly said, because you have a logbook, it needs to be logged before it can be brought in, is because you want to be able to create records so that at any given point in time, if there is an inquiry or if evidence is required, then you can fall back on and you can review this written communication.
So when it goes to court as well, you can actually explain what happened. Like, when you take notes, when you're working, they're legal documents, aren't they? Because it should be accurate and the truth. So I think within 7 years, if you've wrote something and you cared for somebody, within 7 years of that date, you can get taken to court and asked about what happened on the date if it was investigated.
That is correct, yes. So again, the paper trail in terms of written communication becomes important, is because that is what the person who's doing the investigation will actually look into and look into carefully to be able to see if there was a mistake made on on the prescription, or for example on the medication, which has led to this kind of incident.
Yeah.
So I think in particular, when you look at the context, the importance of formally communicating in writing in the health and social care context is important, is because sometimes the information is sensitive, sometimes the person receiving the information is vulnerable, and sometimes the information needs to be reviewed at a senior level before it can be made public, because in the case of medicines, prescriptions, or other things like, for example, if somebody is going to be prescribed a particular therapy and things like that, it has to go through a proper paper trail and approval process, and which can only happen in the form of a written piece of document or written communication. It cannot happen verbally. So a situation that you rightly said, for example, if I have a critical illness and I want to see a consultant and not a GP would then recommend me in writing that you make a consultant appointment and seek this advice. And that becomes important because it is a written form of communication going from your surgery to the from the GP surgery to the the hospital, wherein you're able to then seek a consultation, or are able to see the consultant for your particular problem. Is that okay?
Yeah.
So I think in general, when we look at it, I think there are some of these things when we look at learning outcomes. There are three or four things which are related to the assignment that we want to be able to look at, is how do you look at written forms of communication? And here the idea would be to look at 3 or 4 different forms of written communication, which could be, say, for example, a letter, could be an email, could be a copy of your CV, it could be something which is to do with formal records of meeting. So these are all different forms of written communication that you need to be aware of. And in these communications, the tasks which are given in the assignment brief will ask you to kind of communicate this bit of information using an appropriate written method to understand and complete the assessment for this task, right? So one of the tasks, for example, as I can see, 5.1, it says communicate complex information for a purpose, right? So if I have to communicate complex information for a specific purpose, I would take up an example of a flu jab here, which is a complicated piece of communication which needs to go across only to the targeted audiences which are able to get this flu jab free of cost, or say, for example, need this flu jab during the winters. So it will go across to patients who are aged 70 and over, or it will go across to patients or kids in this case, very particularly for kids who are younger than 7 years, and where the surgery or the hospital would actually prioritize the application of these flu jabs to these individuals because they are vulnerable to, cold and cough during the winter season. And this communication of complex information will happen in the form of, say, a written circular or a written email, which will go across from the surgery to the intended recipient. Are you with me on that? Is that clear?
Yeah.
And so some of the other tasks in the activity are, say, for example, it says prepare for and document a meeting. So here you could document any meeting. So for example, you could document a meeting within the pharmacy, like when you go to a pharmacy, you have the pharmacist for the day. Somebody who is the pharmacist for the day, who is in the managerial position or is in the decision-making position to be able to dispense, prescriptions or when customers come in to get their medicines. So you could document a meeting which happens maybe in the morning, wherein there's a briefing which happens from the pharmacist or the person in charge for that day, and he or she will have that meeting saying, okay, I will look at this type, this is your role today, this is your role today, and that would basically look at task 2. So you could document an office meeting, you could document a meeting with your colleagues that you have, maybe a weekly briefing on Fridays or whatever it is. And an example here would be, which I've said is, you have to just document a meeting to be able to show that it is something that you understand that when you do a documentation of meeting, it primarily means you're drawing up minutes of the meeting.
Yeah.
Is that okay?
Yeah.
So some of the other tasks are convey quantitative data using charts and graphs. So how would I do this in the assignment? Convey quantitative data is what I'm going to look at is like the NHS, for example, puts out an yearly report, or say, for example, NHS would be too broad. Let's look at an A&E department of a particular hospital. When they put out an annual report saying that they received so many calls in A&E, say 20,000 calls, they received so many patients, they transported so many things, they had so many ambulance trips. Those things will nothing be but data presented, not in detail, but data presented using charts, images, bar graphs, and things like that. And that would basically mean that what they've done is they've compiled all the calls which have come in, say 20,000 calls for, say, a particular hospital trust. And out of that, 6,000 calls led to emergencies. That means ambulances had to be sent out. But what they will do is they'll put this out in the form of some quantitative data. Do you understand?
Yeah.
Yeah. So quantitative data is when you put across, say, for example, data in bar charts or figures or pictures, things like that, is something which you have to give an example here in Learning Outcome 5, Task 5.3.
Yeah.
And I could just look at maybe a simple example of what I can recall is my own surgery. What they do is every year at the end of, towards the end of December, they put out, a poster or a A4 size kind of, poster on the notice board within the surgery. Is what they give out is a bit of a summary saying that, we have 15,000 so many patients registered. They talk about the demographics which are displayed in the chart in a pie chart which says we have about 12% children registered which are under the age of 12. We have 80% of the population as adult. Those in bits or pieces of information that they put out, which are put out using charts and graphs, but it is neatly put out on a one pager, basically gives the performance of the surgery across the year. And that is quantitative data, that means data which has been collected, compiled, and it has been compiled to be represented as a snapshot, and that is nothing but quantitative data which has been put across on the in the form of a small notice under the heading performance, or performance of the surgery. Are you with me on that?
Yes.
So sometimes you do get to see that, in pharmacies or in the offices that you go to, they say, okay, we've had no incidents, of when you say in particular visit a manufacturing facility, they normally have a poster or a board wherein they say the last injury in this facility was in, say, 2003. There were so many injuries. Why do they put that out? Because what they want to be able to do is they want to be able to prompt your people working within that facility to be aware of the risks of working here. And at the same time, subtly, they put that data out in some sort of a quantitative form, that is numbers, charts, and figures, so that it reminds the people working in that facility that they always have to be careful.
Well, then sometimes when incidents happened in the past, let's say on country roads, you might see a warning, like a triangle, or like a warning sign with like an animal with a cross on it. But then that's probably gone up there because in the past, the accident has happened. So instead of written, it's like visual communication. But because it's happened once or twice or however many times before, it's a warning sign to prevent it from happening again.
I totally agree. Totally agree, and that is a good example of, we are not interested in all the details of how the accident happened, when it happened. All they've done is subtly compiled all that data and put it into some sort of a picture or a description, and that is nothing but data crunched together into a small chart or a picture which has been put, for the people to be able to observe and understand. So yes, a perfect example. What you said is absolutely fine. And I think in the last task that we are looking at is, it says review written communication. So what you have to do here is, review means you have to basically look at recapping all the different forms of written communication. Look at that. Forms of communication would be things like when we say written form of communication, things like email, things like letters, memos. So what you have to do is you have to basically recap here by writing, some of these communications method, which are written in particular, and then you have to summarize them to be able to cover the task. So particularly, just to look at showing you the command verb review. What does review mean? If I can see where the word review is. I think it's an entry-level command verb, basically to look at the situation or look at presenting in terms of different types of communication, to be able to summarize, the written forms of communication here. Is that okay?
Yes.
Okay, brilliant. So this kind of, what will happen with this is this will bring this unit, which is the unit communication skills for health and social care management, to kind of a close. That means you have most of the details in terms of the sessions, and we have covered the learning outcomes, and we've covered, in, I would say, some detail, followed with the handouts that I've sent you. The major, content of this particular unit for you to start attempting an assignment now.
Yeah.
Is that okay? So my suggestion to you with the assignment, what you're essentially looking at here is that starting would be a good starting point would be for you to be able to look at, picking up this indicative spec sheet. And from here, when you look at the the tasks which are given on this side, on the right-hand side, under the assessment criteria, it's something that you can look at refreshing, which is given here on Moodle. And I would just download that to show that to you in a second. And start to what they've done in the assignment is they've given you a context of an alpha home service. So you are basically a company which is providing auxiliary care agency service to a number of people, and they've given you some example of staff and what they have. So that is to give you a context. And with that context, what you have to do is you have to then start to answer some of these questions or tasks given, right? And one of the things that I always look at and I recommend to is read this sentence, what the one that I've shaded. Can you read this sentence?
Do you want me to read it now?
First bullet point. Yeah.
Assess the different modes of communication you could use for the two groups in Alpha Home Services.
Right. Now, if I just delete all the jargon and English in this, for example, I know access is the command verb, as you can see, if I delete everything else, the different modes of communication, just delete this mode. So what the task is asking you to talk about is, this is the main, thing in the task which is asking you to do. What it is asking you to do is discuss, say in this case, it is asking you to access. So assess, not access, assess, when it says different modes of communication. So what I would do is, I would look at the different modes of communication here. I would go into the spreadsheet, right? And here, because this bit corresponds to, the first bullet point corresponds to task 1.2 or assessment criteria 1.2, I'm going to do is, if I look at this particular indicative content in particular under 1, modes of communication. These are the modes of communication that we have to look at covering. Do you get it?
Yes.
Right? So my suggestion would be, look at the indicative content sheet, look at the tasks, and obviously when I start writing the assignment, what I will do is, I'll have a paragraph on introduction to the assignment, I'll have a conclusion paragraph, but what I would do is write it in the context that, okay, there are different modes of communication, which are used within Alpha Home Services. So I'm adding the context of Alpha Home Services into the task.
Yeah.
Do you follow this?
Yeah.
Okay, so let's look at maybe another one. So for example, this task, has English jargon in it, but for me the importance is, this word, S in particular, and then the other important is the words which are different modes of communication. Let's look at maybe another task, So in task 2, it says, in completing this work, you reflect on communication processes, journey within health and social organizations, and decide that a review will be helpful for your preparation. So if you ask me honestly, if I read this, I am looking at reading this bit particularly first. So what this task is going to ask me to do is review, and what is this asking me to review? Asking me to review and reflect on the communication processes within health and social care organizations. Can you see?
Yeah.
This sentence, which is roughly about 15 to maybe 17 words, I think the key important words for me are these.
Yeah.
Reflect on, and what I'm going to do is, I think in the context of the health and social care organizations, I have to review the tasks. You see. So I think when I look at, say, it says evaluate, which is the command verb. So it says evaluate the formal communication methods and systems used by health and social care. I know I'm doing a health and social care course. I know this is a health and social care brief. I don't need to be reminded on that again, isn't it?
Yeah.
So what you're looking at doing is evaluating the formal communication methods. What are the formal communication methods? This is, under task LO3, learning 3.1, outcomes 3.1. So if I go to LO3, and then what it says is evaluate formal methods, and I'm looking at these formal methods of communication. So you have to write about what is communication, when do you use letters, brochures, websites, newsletters, emails, and telephone calls and all that.
Yeah.
Right?
Yep.
So the indicative content which is given on this sheet, you do not need to 100% cover that in the task. Okay? This is to give you an idea that these are the things that you need to be able to study and you should be aware of. But if I'm doing this task, this is evaluate. Evaluate means you have to look at more than one method to be. And then when you present two methods of formal communication, it could be say face-to-face, and I would maybe use a telephone call, which is happening between Alpha Home Services and a patient. They then become two formal modes of communication. Then what I would do is evaluation means that after putting these two methods, I'm going to look at the advantages and disadvantages, and then I'm going to present my own opinion of why they are important and how they help in assessing services in different contexts.
Yeah.
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 So it should be, this particular unit, is I would say quite straightforward. My suggestion to you would be read the tasks, delete out all the jargons, words which are English words in the sense that which kind of, fade away because they are not the real context of doing the task. The real context of doing the task would be, I start to look at assignments, or when I review and assess as an assessor on this side, when you send me something, this is what I would pick out. So it says assess the communication skills. This is the most important bit. Here I'm asking you in this task to write about the communication skills. Right? What are communication skills? The communication that is discussed are going to be coming here. Okay?
Okay.
Are you okay and are you comfortable with this, what I've explained?
Yeah. I'm comfortable with what you've explained.
Okay, good stuff. So I'm going to try and end the session here now. Before I keep going on and on, but I will try and end the session here. I'll send you this particular presentation, which we have looked at today on LO4 in particular, and the use of technology, which is just the touching point used for LO5.
Can you send me the recording as well, please?
Yes, I can send that to you as well, no problem.
I've got a lesson in a bit after this with Gulshan.
Okay.
Yeah.
That's absolutely fine. I'll send you the recording. It should probably come through pretty much